Assalamu alaikum. My name is Mustafa. I am the leader from the group C, and these are my group members. So I have slides about the history taking skills. So first we have to start by approaching to the patient. How will we approach the patient? So we will hand washing in front of the patient, single most effective way to prevent the spread of the infection. Introduce yourself to the patient to ensure the privacy and comfort of the patient so the patient can feel easy with us for explaining his symptoms. And from that, if you want to examine the patient from this point, you can take the consent from the patient. It sets the patient at ease. These are some steps regarding the history taking. Like we start from the personal data, chief complaints, history of presenting illness, history of pain, past medical, past surgical history, family history, drug history, social history, examinations, investigations, imaging studies, and differential diagnosis and the treatment plan. We will study these step by step. So from the personal history, we have the name, how to ask the questions. For example, can I have your good name, please? Age, how old are you? What about the sex, marital status? Are you single or married? Occupation, what? Okay, so as the first slide is done, I would ask my doctor to start taking the history from the patients.
Assalamu alaikum. My name is Dr. Aimen. I am a final year student. Can I ask you a question, please?
Sure.
What's your name?
Baqir Iqbal,
Age?
24.
Occupation?
Student.
Are you single or married?
I'm single
Okay. Why you are here today?
because I am having cough for
Then we will move to the chief complaints, how to ask questions about what brings the patient to the hospital. Can you please tell me what brings you here? She or he will describe the symptoms. If after describing the symptoms, we can again ask the patient to ensure are there any other symptoms or not. So he or she will tell us about the fever, weakness, pain, nausea, vomiting, etc.
Any other complaint like fever, weakness, or pain?
I have severe chest pain for 5 to 6 days and
Fever,
yes, I have fever.
pain?
No pain, but I'm having headache.
You feel vomiting, nausea,
No,
diarrhea?
no.
Okay.
Okay, from there on, we move to the next step, history of the presenting illness, how to write the presenting illness. It is basically a description of the development of the patient's present illness. The history of presenting illness is usually a chronological description of the progression of the patient illness from the first sign and the symptoms to the present. For example, when did it start? When did the symptoms start? And from how many days are you having these symptoms?
Okay. When
From
did
there on, as the patient said, he has a pain. So from now let's start taking the history of the pain. For example, where is the pain? Ask the patient where about the pain. Where is the
Okay.
pain?
Can you please tell me the location of pain?
I'm having pain exactly right here, left side of my chest.
Okay. Right.
Onset. When did the pain first start?
Okay.
If from the 3 days, then it is acute pain. How long have you been having this pain?
Okay. When did the pain start?
Almost 5 to 6 days ago.
Okay. How long have you been having this?
Almost 1 month.
From there onwards, we can move to the character of the pain. Like it can be described to patient. Is it a sharp, dull, and stabbing pain? For example, if you want to tell it is a sharp or stabbing pain, you can present to him like it is a knife-like pain. Then ask the patient to tell you the quality of the pain. Is the pain constant throughout, or does it come and go?
Okay. Is it sharp pain, penetrating, or dull type of pain?
It's a kind of penetrating.
Okay.
Now about the radiation, ask the patient, does it stays the same or does it goes to anywhere, any other organs locally or not? Where does it move? Ask him to specify the area the pen has pressed to. In this case, he has specified the chest. So, does it radiate?
No.
Now, associated symptoms. Are there any other symptoms that are associated with this pain?
Okay. Any other symptoms associated with this pain?
No.
Okay.
The timing. What time it becomes severe? Ask whether it stays the same throughout or not. Ask how has the pain changed over time. and how long the pain lasts.
Okay, what time it becomes severe, morning time or night time?
During the night when I lay down on bed.
Okay.
Now the next one is exacerbating and relieving factors. Ask what makes the pain better or what makes the pain worse. For example, after physical activities, does the pain become worsened or not? Or is it relieved by medications or not? If you take some medicine for the pain, does you got relief after that or not?
Okay. After physical activity, is it worse or not?
If I'm playing badminton, so after exercise, it gets severe.
Is it relieved by any medication?
No, I don't take any medication for it.
Okay.
Now the last among the pain history is the severity. So you can ask about the severity from the patient, like how severe it is from the scale 0 to 10. 0 being no pain and 10 being the worst one.
Okay, can you please tell me the severity of pain on a scale of 0 to 10? 0 means it's not pain. So,
So I think 5 out of 10.
okay.
Okay, then we move to the past medical history and the past surgical history. How to ask questions regarding this? Like, have you had any serious illness that brought you to see the doctor or the hospital before? Have you had to take off work because of ill health? Have you had any operations? Have you been in hospital? If he was in hospital, ask him why was he in hospital before?
Okay. Do you have any kind of past surgery or disease
No,
like diabetes,
no,
asthma,
no,
TB,
no,
HIV?
no,
Okay.
Then we move to the family history, social history, personal history, and drug history. Regarding the personal history, you can ask permission from the patient that am I allowed to ask you some personal questions? For example, do you smoke? Do you drink alcohol? Regarding the family history, you can ask how many persons are there in your family. Are there any illness that run in the family? For example, any history of the heart disease. What is your lifestyle? Do you exercise? And if you do exercise, how often do you go to exercise? What is your diet? Then you can ask about some drug history. Have you taken any medications? Any other for like any laxatives, any analgesics for the pain, vitamin or mineral supplements?
Okay, I will ask about your family history. How many people are living in your house?
6 people.
Any family member have cough like yours?
No.
Okay.
Then we move to the before the examination, we can check the patient's vital, pulse rate, blood pressure, temperature, respiratory rate, and oxygen saturation, and then the weight. We can also check the height for calculating the BMI of the patient. After that, we can ask some general question, general examination. Among all the systems, we just few questions among the general examination. First is appetite. So how to ask appetite from the patient? Ask the patient, is there any change in your eating pattern? Do you eat more or are your cravings for the food are decreased? Regarding the weight change, have you noticed any increase or decrease in the weight regarding few days for the past few days? Loss of the energy. Do your illness have you not lack of the effort in your work? Ask the patient.
Okay. Is there any change in your eating pattern?
No.
Okay. Have you noticed any drop or increase your temperature?
No.
Okay.
The other few symptoms are disturbed sleep. Is there any change in your sleep patterns? It can be asked regarding the night sweats, the weakness, and the itching and rash over the skin. After doing the general examination, we can go for the few system, like we can ask in the cardiovascular system. Do you feel any tightness or do you have any chest pain? Have you ever noticed your heart rate racing? Look for the murmurs, check for the hypertension, check for edema and ankle swelling. Then the next system is the respiratory examination. Ask about the shortness of breath after going out, or have you noticed any change in your breathing? Do you become short of breath? Have you had a cough? Like she will ask the patient now, is it a dry cough or is it a productive cough? Look for the chest pain, shortness of breath, sputum. Notice, then you can check the color of the sputum. Is it blood-stained sputum or is it not? You just say simple one, just ask the patient.
Okay. Is it dry cough or productive cough?
Product.
Okay.
The next one being the gastrointestinal system. Are you troubling any and do you have any digestion problem? There's specific food you are allergic to, you cannot digest. Have you noticed any change in your bowel habits? Have you noticed any change in the appetite? Look for the abdominal pain, color of the stool, dysphagia, difficulty to swallow. You can ask the patient, is there anything certain that you can't swallow at a time? And about check the oral ulcers by asking the patient to open his mouth. You can check the oral ulcers, any lesions, and hematemesis. The next system being the genitourinary system. You can ask regarding the urination. Do you urinate normally? Do you feel pain when do you go for urination? Do you get up at night and night to pass the urine? And if does, then how often can you go to washroom? Look for the blood in urine. Urgency and frequency of the urine can be asked from the patient. Rashes in the genitals by examining the genitals of the patient, and the kidney stones because it also comes in this heading. The next system being the musculoskeleton. Regarding the muscles or regarding the joints, you can ask the patient. Do you have any pain or stiffness in the joints? Do you have any pain or muscle cramps, any specific muscle? Look for the pain in the neck, back pain, and myalgia, mean muscle pain. The next being the endocrine system. Do you tend to feel heat and cold more than used to regarding last few days? Because as a patient comes to us with a complaint, look for the loss of libido or the sex drive, sweating, and other features among the endocrine. Then we go for the neurological system. Have you noticed any numbness, weakness, or clumsiness in your arms and legs? Have you ever had blackouts? You can check the color of the skin, about the dryness, the bruising, the rashes, the scars, and the marks by examination of the skin. And the last among the systems being is the psychiatric system. Look for the signs of depression, anxiety, personality disorder, hallucinations, and delusions. After examinations, so from the examination list of the possible conditions that say the same system that symptoms that you have noticed in the patients. Differential diagnosis, for example, for pneumonia would be asthma, cancer, pulmonary emboli, etc. As they share the same symptoms like cough, shortness of breath, and the tachypnea. So I would like Aimen to ask the patients what will be your differentials according to his symptoms.
According to symptoms, maybe my differential diagnosis is asthma, TB, and lobar pneumonia and bronchiectasis.
So she has listed a number of the differentials. To confirm it, we will do the lab investigation and imaging studies. Regarding the lab investigation, we can do the CBC, complete blood count, urine analysis, liver function test, blood culture, and cardiac marker. As it is the case of the respiratory system, so we will go for the complete blood count to check the leukocytes count. Is it will there be total leukocyte increase due to the infection? We can do the blood culture and sensitivity to check for any microorganisms. And regarding the imaging studies, computed tomography, CT scan, magnetic resonance imaging, MRI, and ultrasound. As is the case of the respiratory system, she is examined, so we will go for the CT scan or CT scan of the chest. No, sorry, X-ray of the
Yes,
chest.
correct.
And after excluding the differentials on the basis of the lab investigations and imaging, we will go to a definitive diagnosis. On the basis of the diagnosis, we plan the treatment plan for the patient. It can be medical or surgical or both, depending on the specific disease of the patient. As this was the case of the respiratory system, so it probably pneumonia or anything. So we will as it is due to the bacteria, there was found to be sputum that was a productive yellow color or green color sputum. So it was due to the bacteria. Probably the bacteria involved would be the Streptococcus pneumoniae or any other. We would find that in the blood culture and sensitivity test. Regarding the X-ray, we could find some consolidation in his lung. So diagnosis could be lobar pneumonia or etc. So regarding that, we can plan the treatment for the patient. It could be we can put him on the antibiotics, and that's it. Thank you. Is it? I'll finish, sir.
Last slide.
Oh yes, sir.
As you can, all of you can witness why this presentation won.
was because of the simplicity and the precision of the question asked. Number one, the review of systems. First of all, the personal data sheet contained history of presenting illness, everything was precise, and the least questions to be asked at your level and our level by a house officer or doctor were all of them were mentioned in the slide. The second reason was during the review of systems. Only the major and important questions were asked again with the precision, and only the least questions needed at that time. And finally, for the pain history, again, very briefly written, very precisely written. So, if you have 15 minutes per patient and you are very good at this, at least this slide, you can review the patient's history in detail within 10 minutes or 15 minutes while taking notes. So that's why this is one of the, these are three reasons basically I found this slide to be precise and to be the winner of the day. So, well done, Bache.
Yes, sir.
Gavin, please.
If your teacher or mentor believes you can do something, you are more likely to do it. Thanks.
So, actually, thanks to you from all of the classmates. So, these would be the least questions I want you to, all of you to prepare for the exam. If there is a history taking, I told you half of the students will meet with a history taking skill. There will be a random scenario, and then you have to present history on the history taking sheet with you. You will fill all the requirements, and there will be a patient. And these are the least amount of questions and precise questions you need to ask. The second slide of the day was group H, and if you want to go in the detail of this slide, you can refer to group H. So let's, without further ado,